आज हम खड़े हैं वेस्टर्न बाल्कन्स यूनिवर्सिटी में, एक यूनिवर्सिटी जो अल्बानिया की सबसे बड़ी हेल्थ केयर यूनिवर्सिटी है. We are at the gate of Western Balkan University. So these would be the classrooms. You would see a lot of screens, speakers where you would be attending your classes, and along with that you would also see the whiteboards where you'd be taught for your all the courses and everything that is related to nursing.
My name is Alice. I am a professor here. I am a teacher who is responsible for the 4 labs of this building. This is the simulation lab where dentistry will perform all the hours of practices from the very first year until the 3rd year, basically. Now just right your head. Do that.
Yes, welcome to the anatomic laboratory. Here, after the students have taken all the lectures, they come here to touch everything, because first they take the lections on the halls, on the classrooms. The students come here every single day and they have the opportunity to work on the models, on 3D models.
Hi students, today we are at a place where everybody was having a lot of questions about. आज हम खड़े हैं वेस्टर्न बाल्कन्स यूनिवर्सिटी में, एक यूनिवर्सिटी जो अल्बानिया की सबसे बड़ी हेल्थ केयर यूनिवर्सिटी है. We are at the gate of Western Balkan University. We'll be showing you the entire university, the labs, the classrooms and everything in one go. This is the entrance. This is the entrance from you would be entering the university. Once you come here, you would see the lounge, the area where you could enter, rest. You would see the flags of different countries. These flags represent all the countries from where the students or the staffs are coming from. You would say more than 25 countries, students studying here with staff from different countries and faculties with a renowned experience in their respective countries. Hi students, so we are at the first floor of Western Balkan University. Here we have all the auditoriums, classes where you would be attending your seminars. We'll visit all the seminars and auditorium one by one, any of these. So these would be the classrooms. You would see a lot of screens, speakers where you would be attending your classes. And along with that, you would also see the whiteboards where you'd be taught for your all the courses and everything that is related to nursing. So this is the auditorium. Here you would have all your seminars, all your lectures would be conducted. You see the whiteboards everywhere. This is the settings that you're gonna see with all the screens, even for the students who sit at the back. So we also have the conference hall here in Western Balkans where you would be attending all the important meetings, big meetings and the conferencing. So it's the midterm going on and the students are having their exams. So we'll be a little quiet and you can see all the classrooms filled with students attending their midterm exams. As we mentioned that we have all the labs here, we'll be visiting the labs one by one. This is the first lab that we'll be visiting. We already have a professor here who heads the lab. Hi, it's Keshav.
Hi, my name is Alice. I am a professor here. I am a teacher who is responsible for the 4 labs of this building. This is the simulation lab where dentistry will perform all the hours of practices from the very first year until the 3rd year, basically. In this lab, we perform the opening of the cavities, we perform the learning of the arches, basically, and of course the closure of the patient's mouth, basically. Now, if you see the equipment, here you can also see that this simulates of how the patient will look like inside the clinic. How will it look like if a cavity is underneath the tooth, and how will it be prepared, and how will it be filled basically with a dental with a dentist basically. Now, in this situation, I can show you, of course, how the mannequin will work. This is pretty much what the professor will do on their table, and of course the student will be able to see and to notice basically how will it work and how will it look like. And also we have all the dental equipments that you can see on here. The basics, basically what the students will need to perform during the hours of the practices. Three basic equipments for working basically onto the mannequins. The mannequin's mechanism is it moves basically the head of the phantom up and down, of course, and both of the models can be removed and seen by the students physically, not only on the mouth. Also, we have the real teeth, where our students will see and will practice their work. While we see the real teeth, all of those are found during the hours, since the students do have their interest. They are found inside the dental clinics, and they perform it not only in resin teeth, not only on the mannequins, but also into the real teeth that can be found inside the clinic. And also this is all of the equipment of the students, basically. We can move on to the next lab, which is going to be where the chemistry will also happen. Now, this is pretty much where all the wax that they have modeled, basically, and they have designed, will be converted into something else, or into a final work. And we have organized all of this lab from here, which is the dental stone part. Afterwards, we go to the polymerization part, and then after the polymerization part and washing, we go to the polishing part, basically. Now, this is pretty much where about the dental technicians will perform their studies, basically. Also, in this part into here, as I said, we do the dental stone models, and we can also make the bites, we can make the study models and the final models as well. It should not look like that one, basically, but this is just for showing how will the mass and how will the model will be poured and how will it look like at the end of it. On to the next lab. This is the other part, basically, of the whole building. So we have also all of the clinics. This is one of the clinics which is called the oral diagnosis. The patients basically will join us here, and of course will perform, the doctors and the staff will perform the examinations, the necessary examinations that the students and the staff will do, basically. This is going to work, and it is going to function just like a clinic, like not a commercial one, but a university clinic. In this part, basically, we perform everything that we have done into the simulation lab. We do it also here, basically, but with real patients, exactly.
This is something which is, I believe, a great opportunity for the students that they can do it on campus. Most of the time, they get the exposure of this in the hospitals when they start working. So it's a great opportunity that they can learn it in the campus itself.
That is correct, basically. And I would also say that the one part of their experience, it will also always be the fact that they are going to gain experience from the simulation lab into here as dental assistants, and then move on to the other clinics as soon as they finish basically the university. This is pretty much the thing, basically, of one of the parts of the clinic. And the other part is whereabout we do all the therapy, and it is called a multidisciplinary clinic. We have set it up basically in this part and in this way, in order so it can be more practical for all of the students that are going to join basically the practice here. Not only the students, but also the patients, basically. All of this part is going to be...
I've seen a lot of machines here. Can I just try one of them?
Sure.
I just want to make sure that I want to see how the patient looks like.
Sure, of course.
It looks a little modern.
Yes, exactly, it does actually. Let me do that. And we shall see, basically. Now this is how, do you feel, let's say, as if you are in a dental clinic? Now just rest your head.
Nothing.
We do that. That is pretty much it, basically, for the chair. Thank you.
Yeah, they look quite modern.
Yes.
Student would definitely get a very good exposure on these machineries, because this is something that they can only see in universities where they could learn futuristic machines. It's very much necessary for them, for their academics.
Yes.
These are not just the ordinary machines, these are quite advanced. With everything, I believe here is gonna help the students to have futuristic academics and everything.
That is correct, basically. And as I was making a conversation with somebody else just before, we were saying that AI is not going to replace basically the dental clinics, because the conversation and the way that we speak with the patient can never be replaced by a computer.
True.
You felt basically that way, and I'm pretty glad that you tried it. So thank you very much.
Thank you so much. So now we have entered another block, which is block B, where we'd see the other ancillaries, the other labs and everything. So this is again a lab where the student uses the AI tools, computer science engineering and everything to make the equipments futuristic. So you will also be a part of this. Now we'll be going to one of the most important something which is very important for a student academic. We'll be entering the library of the university. So you would see that it's a huge library with all the knowledge that you need. You would find it here. It's again, depending on the expertise that you follow, depending on the course that you follow, you would find all the books here. These libraries are available for the students all day long. They can just come study here and make a most use of this. Also, we have the people working in the library. We have the library attendant. I'll see if she's not busy, we'll have a word with her as well. Now we'll be entering another very much important lab in a healthcare industry, which is anatomy. You see a lot of skeletons, a lot of skulls, and everything that you need to know about a human body would be here. You also have somebody, I believe she is a professor. We'll see and we'll talk to her how the students go through their labs here. So I believe we have somebody here, a professor, I believe. Hi, it's Keshav this side. I was visiting this university as I wanted to show the students how they go through their daily life, the labs and everything. So I see this fascinating lab, anatomy. It's something that every healthcare student go through, be it MBBS, nursing, if you're part of healthcare, you go through this.
Yeah.
So could you just let us know and the student know how they go through their labs here in Western Balkans?
Yes, welcome to the anatomic laboratory. Here, after the students have taken all the lectures, they come here to touch everything, because first they take the lections on the halls, on the classrooms. The students come here every single day and they have the opportunity to work on the models, on 3D models. We have for each of the models at least 3 to 4 copies, and they can start working here independent or depending on us, because they can ask a lot of questions if they need to. We have key books that we can help them, or they can read on independent way. They start with working with the models. They are separated in small groups, so each of them, 3 to 4 students, can work on a single model. Here we have not only skeletal, actually, we have a lot of models. We can see if you want.
Yeah, sure.
Here we have the reproductive system. We have for female reproductive system. This is very important because here we can see even the fertilization, how it happens, and every single of these models can be used on their daily basis depending on the lectures they are having on their classrooms. Here we have gastrointestinal system, everything is on their service. Also, we are not stopped by working only on models, but also we have the anatomage table. In there, we are using actually real bodies that are dead from different reasons, but we are using them now for science reasons. They can see their real bodies actually, and we can remove some parts so they can see very, very clear every single of their system that they are interested.
Great. Shall I enter?
In fact, we have in stock better views and microscopes without covers. I can provide some other better views, I think.
Yeah.
Even with students.
Now we have entered the cafeteria of the university. This is the cafeteria where the student can take a breather, do a little resting, and if they want to have their meal or eat something, they can do it here. It's not just this much, we also have open rooftop as well on both the aisle. It's here as well, and even on the other aisle as well. Hi students, so we are at Spitali American 2 hospital. Here's where the students from Western Balkans and other universities do their internship. So we have somebody, we have Jay, who is doing his internship in the same respective college. So we'll have some questions with him. We just wanted to know, because a lot of students from Western Balkans and other universities do their internship here. So how the internship works here? How much time do you invest in your internship and how much time you invest in your studies?
So we have 6 years total.
Yeah.
The first year, in the second semester, we start our clinical practices.
Okay,
to
for medicine.
to gain in medicine, to gain clinical experience. Okay. Usually in the first semester, they give an overview on what to expect as a doctor and to know like how the whole hospital runs. They give a basic knowledge, so it's more theory. The second semester, you start going to the hospitals, and we have our university is affiliated with 4 hospitals. American Hospital 1, 2, 3 and Hugea Hospital, which is near the university. So we spend usually one time we go to the hospital per week.
Per week once?
Yeah, per week once for a few hours.
How many hours it is in a week?
4 hours.
4 hours.
Normally on a 4 hours.
Oh, that's great. Also, do you think that it's enough internship being given to you, and is it helpful for you doing this internship from one of the biggest hospitals in Albania? Does it help?
To be honest, yes. We cannot expect much. It's okay. I'm a first year, so we don't expect much because we don't know much.
Yeah.
But yet it still helps us, so we get a real idea on what does actually going to the hospital means. Like what do you actually do, and how does your theory studies that you're doing in university correlate to you spending in the hospital or you applying it in the hospital. Yes, we don't get to see patients touch patients physically yet that much. So we don't get to we get to see patients, we get to relate to them, we understand why they came here. So there are patients who have already been examined by doctors. So it's easy for us to understand and correlate it to our studies that we're ongoing right now. And the curriculum is designed such that it's right now they take it step by step in a spiral curriculum. So it's not everything done in one go. It's gone step by step every year you're going to pile on something new, and so it's easier to understand it.
So I believe just after 1 year having internship is again something very
Something
good.
really good, yeah.
Because what I've seen in India, what we have seen in India, that you complete your entire education and
Yeah.
then you do the internship. So this is again a very good opportunity that simultaneously when you're completing your studies, you do get an exposure to the practical knowledge.
Yeah.
And this is just the second year. Hopefully by the year third,
Yeah,
fourth, you would
because
start
it's
exam.
5 plus 1 years according
For
to
medicine,
yeah,
yeah.
and you actually have 1 year dedicated to internship only.
Only.
So these are like you're learning on the go.
So this would be considered as your CPD continue.
Yeah, continued professional development.
Oh, that's great. So with that, I believe you have had all the information for Western Balkans University and about nursing, the other co-curriculum activities, the labs, the structure, and even the internship that is being given by the hospitals. If you still have any questions, just drop your questions in the comment sections and we'll definitely assist. We would really be glad if you can directly call us for anything related to nursing, physiotherapy, dentistry course in Western Balkans or Albania. Thank you so much.